next topic is neck pain. Now, neck pain again is something that most of us have experienced in our life. Some of us experienced it for days or weeks. Some of us even have chronic neck pain or relapsing episodes of neck pain. And if we look at the neck, obviously it's an incredibly complex area. We have the cervical spine, of course, made up of 7 vertebrae and our discs, and there's 2 sets of joints at every level. One's called an uncovertebral joint, one is called a facet joint, and then associated with that are the nerves, the muscles, and then of course all the other structures that are present in the neck region, which of course is the trachea and the esophagus and more superficial nerves and more layers of muscle and so forth. So it has a pretty important role to play, which is to allow our head to swivel in 6 different directions. And what we find with people with neck pain is often that the point that they get neck pain is obviously long down the line from issues related to how their actual posture was. So it's very important that we understand that the head is supposed to be on top of the neck, so that people who have what we call a forward head posture, where if you like they're actually have moved forward with their head, is very much a risk factor for developing neck pain later in life from profound muscle spasm that occurs because their posture is not an optimal one for them. And it's quite easy in modern life, when we've got our little tablets and our iPhones and so forth, to actually end up with shoulders that round forward and a little bit crowded on the inside space, and that allows people to move their head forwards. Whereas our more traditional way that our grandparents walked and carried themselves was with their shoulders back, a nice erect posture, and typically in that situation the head is in a very good alignment. So in modern life we've tended to develop this less optimal position, and I think probably the incidence of neck pain is increasing as a result of that. So the first thing to say, whether you have neck pain or in fact if you don't have neck pain, is how good is your posture? Have you had a look in the mirror to see what your posture is like? Or in fact, have you had somebody else check out your posture? It just can be a family member. And one of the keys to know that you've got a good posture is if somebody's looking at you from the side, then if they draw a line from your ear hole and drop it down to your shoulder, they should see that there is an alignment between the actual ear and your actual shoulder area or trapezius muscle. If, however, if they drop a line down, the ear hole is actually in advance and in free space at the front here, you have a forward head posture. And that likely could come back to bite you in years to come. So people should actually be aware of what their posture is like. They should work on correcting that posture, which means you have to become posture aware, which is a little bit tricky, but one way to do that is to actually, every 15 seconds, think, where am I in space? Do I need to correct my posture? Just put a finger here on your chin, bring yourself back into a good neutral alignment. And as you do that over and over through a day and a week and a month, it suddenly becomes second nature. And you don't need to do that anymore. You merely carry yourself in a better posture. And that will typically prevent these muscular issues from developing over time. Now, beyond that, if we start to think about people who've got persistent neck pain, and we can divide that into sort of one group is spontaneous onset of neck pain, and another group is a smaller group, but people who experience a whiplash type event, typically in a motor vehicle crash, for example, especially a rear-ended motor vehicle crash. We'll come and talk about that in a moment. But for people who've got chronic neck pain, we kind of look at their age to try and decide what might be perhaps the most starting likelihood of an underlying condition. The vast majority of neck pain is muscular, and the vast majority of that is self-limiting. So we might have a crook neck or a wry neck, as it's sometimes talked about, for a period of time. And the key is to stretch that out. The key is to actually not try and freeze up and protect yourself as if you've had some terrible damage and you can't move. It's okay to actually stretch an uncomfortable muscle, because that will help it get back to its normal length and normal sort of operating point, if you like. So treating your injury as non-significant, if it's just come on spontaneously, in the first instance is very appropriate, and doing some regular stretching exercises of those sore muscles will generally yield a faster resolution. If something is persistent, then we might need to have that investigated further. You might be seeing a physiotherapist. Some people will see chiropractors, for example. And obviously, if it's chronic and disabling, you might end up in a pain clinic, for example. For some people, if they've had a heavy lifting episode associated with the onset of their neck pain, then they may have had an injury to the disc. And that can be determined both by clinical examination and by an MRI scan to actually look at the state of the disc and assess it. Particularly if a person has a type of nerve pain travelling down their arm, then an MRI scan may be ordered if the symptoms are persistent to evaluate if there's any narrowing of the nerve by a little bit of bone spur or by a little bit of a disc protrusion. So that's called nerve root impingement, for example. For the group that developed their neck pain in their 50s, 60s, 70s and 80s, it may well be more related to actual arthritis of the spine. And that arthritis typically is in the little joints at the back of the spine, which are called facet joints. Used to be called zygohypophyseal joints, but it's a bit of a mouthful, so we tend to now call them facet joints. A lot of the time that doesn't necessarily need treatment, but for those people with persistent pain, we may need to evaluate which facet joint is causing the problem. That can be done by injecting a small amount of local anaesthetic to numb the facet joint and then determining if that pain disappears or not. That's called a facet joint block. And if we determine it's a particular facet joint that's causing the problem, then if it's persistent, one can actually knock out or block the nerve to the facet joint for a period of time, typically about 12 months, by actually heating the nerve to the facet joint. And that's called cervical medial branch, that's the name of the nerve, radiofrequency neurotomy. Again, another mouthful. So there are some techniques that can be done to manage the intensity of that pain, but none of this is curative. None of this is reversing the arthritis. It's blocking the awareness of pain from the arthritis. And there are simpler things that can be done in conjunction with that, such as taking paracetamol, such as taking anti-inflammatories if they are indicated, and ensuring that the person is taking the natural components that also seem to reduce arthritis type pain. And that consists of things such as omega-3 fish oil. For some people, they will respond to glucosamine with chondroitin sulfate. Some people will respond to curcumin, which is an extract from turmeric. It's not universal, so people have to try different things. One thing that I want to come to now is, as I said, to talk about whiplash conditions. So people who have neck pain after whiplash, it's called whiplash-associated disorder, or WAD. Some of those patients will have profound muscle spasm. A few patients, and not many, will have actually damaged some of the structures in the spine. So the first part is to assess which is which, and the second part is to really encourage that person that despite pain, the stretching program that will be put together by a therapist is really, really important. Plus addressing the sleep issues, plus addressing the distress that comes from having persistent pain. All that is part of a global or holistic package that we want to address for people who have whiplash-associated disorder. And a very small group of them might need to go on and actually have those facet joints treated, for example. We are still learning more about that condition. So if you tune in a year's time, we might have some more information to give you. But certainly it is a treatable condition. So in summary, neck pain is something not to be feared. It's common. I don't think there'll be a human on the planet that wouldn't go through their entire life without an episode of neck pain. And the key is to, as in all these things, optimize your neck health, your postural component of stability, and ensure that that is as good as it can be for any future potential episodes of neck pain.